Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. Today in this video we are going to talk about total leukocyte count. We can also say that total WBC count. Now in total leukocyte count is actually it is a test which we determine the total number of white blood cell in our body. All of you better know that white blood cell or leukocyte is actually the amino system, or it is actually amino cells that are involved in the amino system. Means that it can protect our body against infective disease like bacterial or viral disease. Now what are the purpose of TLC? Now why we perform the TLC? We mostly perform the TLC when there is a chronic or acute infection. We mostly perform this test to find out the leukemia, different types of the cancer like leukemia. We also perform that test to just find out the autoimmune disease like immune disorder. We also perform that test to just find out the effect of chemotherapy as well as radiotherapy. We also perform that test to find out the allergic reaction inside our body. Now let's see what are the requirements that we need while performing the TLC. First of all, we required the blood. So blood should be taken in AGTA tube, as you can see. Second, we need a white blood cell pipette. As you can see, this is the white blood cell pipette. Now this white blood cell pipette, these are the volume of the white blood cell pipette, as you can see. Okay, it contains from 0.0 to 11. Now from to 0.5 we have to take the blood till to 0.5, and then we have dilute it while taking the dilution fluid up to 1.0. so this is how we can use this white blood WBC pipette. So we need WBC pipette. We need white blood cell diluting fluid that can dilute our white blood cell, means they can rupture the red blood cell as well as the platelets. So only white blood cell we have by using this diluting fluid. Now then we need a microscope. Mostly we need light microscope. We need a stain which we called it Leishman stain. Next we need slides. As you can see, these are the slides, and we also need hemocytometer slide, or we can say neubauer chamber. Now how many methods we have to do the TLC? We have two methods. First we call that simple slide method, and next we call that hemocytometer or neubauer chamber slide method. Now first of all, let's see the simple slide method. In this method, what you will do, first of all you will take the slide, as you can see, and you will place the blood drop. Now this is the blood drop. You will, once you take the blood drop, then what you will do, you have to make the blood film or blood smear. Now how you will make it? First of all, you will take the first slide that contain your blood drop, and then you will put the next slide at almost 15 or 45 angle, as you can see in the picture. Once you do that, then what you will do, you will just push the slide at forward direction. Now at backward direction. After that, once the blood is arises, as you can see, when the blood is touched to this slide, so what happen, then you will push the slide at forward direction. Due to this way we get the blood smear, or we get the blood film, as you can see. So this is how the blood film is formed. The blood film should be normal, not very thick, not very thin, otherwise the blood count will be not, we cannot visualize the blood cells. Now once the film is formed, then what you will do, then you have to put the Leishman stain. This is the Leishman stain. You have to cover the whole slide with Leishman stain. Once the slide is covered, then you have to take it almost 2 to 5 minutes. After 2 to 5 minutes, gently or with slow running tap water, you will wash the slide, and after that you will see the slide at that. So this is the slide after the staining. Now keep the slide at room temperature, due to which the slide will dry, and after that you will examine the slide under the light microscope. At 100x at 40x we will focus it, and at 100x we will visualize the cells, as you can see. Now these are the basophils, because we better know that white blood cell contain eosinophil, basophil, neutrophil, lymphocyte and monocytes. So basophils are look in this form. Let me show. These are the basophil, as you can see. Eosinophil will be look like in this form. Neutrophil have 3 lobes of the nucleus. Eosinophil have spectator like nucleus. Lymphocytes are agranulocytes. It means that they have just nucleus, and the nucleus occupy the whole cell surface area, the whole cell area. We have monocyte can also occupy the whole area, but just the difference is that lymphocyte is a little bit smaller as compared to monocyte. Now these are the RBC under the light microscope. As you can see, these are the RBCs, and the platelets will be look like in this form. So among all these blood cells, the platelets are very small in size. So these are the cells that you mostly visualize under the light microscope. Now this is the method of simple slide method, whenever you want to find out the TLC by simple slide method. Then let's see that how you can find the TLC using hemocytometer or neubauer chamber. What you will do, first of all, you have to wrap your finger, as you can see. Once your finger is wrapped, after that what happen, you have to prick it using a sterilized needle. Now the area of the finger is pricked using a sterilized needle. Now once it is pricked, so what happened, the blood will come out, as you can see. Now after that what you will do, you have to pick this blood, or you have to suck the blood using white blood cell pipette at 0.5 mark, as you can see. So the blood is picked or sucked at 0.5 mark. Now once it is sucked, so you have to dilute it using white blood cell dilution, as this is the white blood cell dilution fluid. So once it is diluted, means you have to suck it when the bulb, this is the bulb area, when the bulb area is filled. Once it is completely mixed with the dilution factor, then what you will do, you will have to put it into the hematocitometer. So this is the hemocytometer slide, as you can see. So before that, first of all, you have to put the slide cover slip, and under this cover slip you have to load what between this cover slip and this surface of the slide. Then you will load your blood that contain the dilution fluid factor. So it is diluted, means, so you have to load it. So once you load it gently, so what you will find the structure like that. After that you have to see a white blood cell under the light microscope. Now you have to visualize the blood cells at 40x, so the area will be focused, but at 100x you will visualize the cells. So remember guys, when the cell touches that area, so count those of the cell. Let's suppose the cell touching the lines, so you have to count that area. Now as you can see, these area are the white blood cell counting area. So white blood cell are mostly counted at that area, and we mostly count the red blood cell at that particular area. As you can see, the platelets are also counted at that particular area. So once you count the white blood cell at that 4 corners, as you can see, so what you will do, then you have to find out it. So how you will calculate it, you can calculate it that you have to count the cell and you have to multiply it with the dilution factor. Let's suppose we have 96 cell count, and then we have to multiply it with multiply by 20, means the dilution factor would be 20, and the square are what, area counted square are 4, and moreover we have 0.1 depth, mostly it is 0.1 depth. Now multiply each and everything, so you will get the value. This is the value you will get, and you have to multiply it with 10⁻�3. So this is how you can find out the WBC count by using this formula. Now this is the white blood cell counting in using hemocytometer, and this is the white blood cell count using simple slide method. So this is actually the white blood cell count, and this is 59 white blood cell we have, and we count it in using 10 field. So you have to divide the 59 cell at divided by 10. So what we get 5.9. Then we have to multiply it with 2000, that is actually the dilution. Once we multiply it, so we get 11,800 white blood cell. So this is how we can calculate the white blood cell total leukocyte count. Now the normal range of the white blood cell we have in adult, we have 4,000 to 11,000 white blood cell. In newborn baby we have 10,000 to 25,000 white blood cell. At the age of 1 to 3 year, the white blood cell count is 6,000 to 18,000. At the age of 4 to 7 year, we have 6,000 to 15,000 white blood cell. At the age of 8 to 12 year, we have 4,500, 13,500 white blood cell count. Now, at what condition the white blood cell decreases? Remember guys, when the white blood cell decreases, that condition is called as leukopenia. Means if the white blood cell decreases from below to 4,000, it means the condition is called leukocytopenia. And leukocytopenia are mostly occur at severe infection. How? Because there are different types of the bacterial and viral infection that can cause the rupture of the white blood cell. We have liver and spleen disease. All of you better know spleen can store the blood, so it is a blood bank. So if there is a spleen disease, so obviously what happened, WBC is decreases. Liver especially important, that perform a metabolism process. So if there is liver disease, so obviously the white blood cell decreases. Bone marrow and autoimmune disease, means bone marrow, all of you better know they can make the white blood cell or all the blood cells. If there is bone marrow disorder, so white blood cell decreases. Autoimmune disease means if there is a autoimmune, let's suppose immunity are attacking on the tissue, so definitely if it attack on the bone marrow, so what happen, the white blood cell decreases. HIV, mostly we better know that HIV are a human immunodeficiency virus. It can attack on the white blood cell, due to which white blood cell are decreases. Lupus, again the autoimmune disease. We have radiotherapy. In radiotherapy, what happened, mostly in radiotherapy we mostly targeted the cancer cell, but due to the radiotherapy, what happened, the useful cell are also be destroyed. That's why in radiotherapy the leukopenia may also occur. Then we have lymphoma. In case of the lymphoma or lymphocytes cancer, in this case the white blood cell are also decreases. It is due to the increase of the lymphocytes and the decrease of the other white blood cell like neutrophil and other cells are decreases. Then we have use of excess use of antibiotics. So obviously when we use more and more antibiotics, so it will also affect on the white blood cell. That's why white blood cell are decreases and it can cause leukopenia. Then on what condition the leukocytosis happen? Leukocytosis means when the white blood cell count are more than 10,000. This is called leukocytosis. Leukocytosis mostly occur in case of infection, means in case of bacterial and viral infection. So if there is a bacterial or viral infection, so what happen, the white blood cell are in a large number, because white blood cell, we better know that it is mostly increases because white blood cell is actually destroying the bacteria and viruses. That's why it is increasing. White blood cell is also increasing in case of smoking, burn and surgery. In case of smoking, it can cause a mutation in the white blood cell. In case of the burning, in case of the surgery, it can also due to this way the bone marrow is activated and it can release large number of the white blood cell. That's why we can say that in case of burn and surgery, white blood cell is also increases. Again, in case of tuberculosis, the white blood cell is increases because tuberculosis is a bacterial infection. In case of leukemia, we better know that leukemia means blood cancer, so in this case the white blood cell is increasing. Then bone marrow tumor. So bone marrow tumor means bone marrow disorder, or where is the bone marrow cells are in a large number, and due to this way a tumor is formed, and due to this way what happened, there is a large number of TLC or large number of white blood cell are releasing. That's why we call that leukocytosis. During stress condition, the stress condition, white blood cell also increases. Ball disease actually the inflammation of the or the inflammation of what, the inflammation of intestine. We have rheumatoid arthritis. In rheumatoid arthritis, what happen, the joints area or the bone area are disturbed, or the bone area are destroyed. And then in allergic case, what happen, in allergic case again the white blood cell is increasing. Means if there is pollen or any dust particle are internalized, so due to this way white blood cell are trigger and it is increasing. In case of asthma, tissue damages, and in case of pregnancy, the white blood cell can also be increasing. In case of corticosteroid, so we better know that we mostly use corticosteroid to just boost the immune system. So if we use corticosteroid a lot and a lot for a long period of time, so what happen, WBC will be increased and it can cause leukocytosis. So this is all about the TLC. I hope you guys get idea about that. Thanks for watching.